Greetings, health enthusiasts. Welcome to Dr. Nguyen's Health Tips. Today, we'll journey into a common, yet often misunderstood health condition called Gastroesophageal Reflux Disease, or GERD for short. GERD is more than just heartburn. It's a complex condition that affects millions worldwide, impacting their quality of life. Over the next few minutes, we'll delve into its intricacies, shedding light on its causes, diagnosis, treatment, and prevention. We'll even explore the impact of diet on GERD. So, stick around to learn more about GERD, its causes, diagnosis, treatment, prevention, and the foods you should eat or avoid. First things first, what exactly is GERD? GERD, or Gastroesophageal Reflux Disease, is a chronic digestive disorder. Now, to understand GERD, we need to briefly break down how our digestive system works. Normally, when we swallow food, it travels down our esophagus and into our stomach. There's a band of muscle at the lower end of the esophagus called the lower esophageal sphincter, which acts like a one-way gate, letting food in and preventing it from coming back up. However, in the case of GERD, this gate malfunctions. It doesn't close properly and allows stomach acid to flow back, or reflux, into the esophagus. This backwash of acid can irritate the lining of your esophagus, causing discomfort and potentially leading to complications if left untreated. So in simple terms, GERD occurs when the stomach acid frequently flows back into the tube connecting your mouth and stomach. Now that we understand what GERD is, let's explore what causes this condition. Scene script. GERD doesn't just happen. There are several factors that can lead to its development. Let's start with lifestyle factors. Being overweight or obese increases abdominal pressure, which can push stomach contents into the esophagus. Similarly, tight clothing or belts can also put extra pressure on your abdomen. Smoking is another lifestyle element that can contribute to GERD, as it weakens the lower esophageal sphincter, or LES, that key muscle that keeps stomach acids where they belong. Next, we have diet. Consuming certain foods and drinks like chocolate, peppermint, fatty foods, coffee, alcoholic beverages, and acidic fruits and juices can trigger GERD symptoms. Eating large meals or eating close to bedtime can also exacerbate the problem. Medical conditions play a role too. Hiatal hernia, where the upper part of the stomach bulges through the large muscle separating the abdomen and chest, can cause stomach acid to flow back into the esophagus. Conditions like scleroderma and sarcoidosis, which affect the muscles of the esophagus, can also lead to GERD. Lastly, certain medications, such as those for asthma, antihistamines, sedatives, and antidepressants, can cause the LES to relax, allowing stomach acid to reflux into the esophagus. It's important to remember that these factors don't guarantee you'll develop GERD, but they can increase your risk. Everyone is different, and what triggers GERD in one person may not trigger it in another. Understanding the causes of GERD can help us identify ways to diagnose it. Diagnosing GERD is not as straightforward as one might think. It's a process that involves a few key steps, looking at symptoms, analyzing medical history, and conducting diagnostic tests. Let's start with symptoms. Chronic heartburn is the most common symptom of GERD. It's that burning sensation you feel in your chest, often after eating. Other typical symptoms include regurgitation, where stomach acid or food comes back up, and difficulty swallowing. But remember, these symptoms can also occur with other conditions, so it's vital not to jump to conclusions. Next, your doctor will delve into your medical history. They'll ask questions about the frequency and severity of your symptoms, any medications you're taking, and your lifestyle habits such as diet and smoking. This information helps to paint a clearer picture of what might be causing your discomfort. Lastly, we have diagnostic tests. If your symptoms and medical history suggest GERD, your doctor may conduct tests to confirm the diagnosis and rule out other conditions. These tests could include an endoscopy, where a small camera is used to examine your esophagus, or an ambulatory acid probe test, which measures how much acid is in your esophagus over a 24-hour period. This diagnostic journey is crucial, as it ensures that the treatment you receive is tailored to your specific situation. It's all about finding the root of the problem and addressing it effectively. Once GERD is diagnosed, it's important to start treatment immediately to prevent complications. So if you're experiencing symptoms, don't hesitate to reach out to your healthcare provider. Treatment for GERD aims to reduce symptoms and prevent complications. Now let's dive into the various treatment options available for managing GERD. The first line of defense often involves making lifestyle changes. This could mean adjusting your diet to include less acidic foods, or making the effort to lose weight if that's a contributing factor. It might also involve changes to your sleeping habits, such as elevating the head of your bed to prevent acid from traveling up into your esophagus. Remember, these changes are not about quick fixes, but about long-lasting habits that can help manage your GERD symptoms. Now, if lifestyle changes aren't enough, medication might be the next step. Over-the-counter antacids can provide quick relief by neutralizing stomach acid. For more persistent symptoms, your doctor may recommend H2 blockers or proton pump inhibitors. These medications work by reducing the amount of acid your stomach produces. Remember, while these medications can provide relief, they're not a permanent solution. They're meant to manage your symptoms while you make those necessary lifestyle changes. Always consult your doctor before starting any new medication. In some cases, when both lifestyle changes and medication aren't enough, surgery might be considered. Procedures like fundoplication can strengthen your esophageal sphincter, preventing acid from backing up into your esophagus. However, surgery is typically a last resort, used only when other treatments have failed. Finally, it's important to keep in mind that every individual is unique. What works for one person may not work for another. It's about finding the best treatment approach for you, working closely with your healthcare provider to tailor a plan that will effectively manage your GERD and improve your quality of life. While treating GERD is crucial, prevention is always the best cure. In the next section, we'll delve into how you can prevent GERD from developing or worsening. Stay tuned. Preventing GERD involves making certain lifestyle changes. It's not about drastic measures, but about making small, sustainable adjustments to your daily routine. Firstly, maintaining a healthy weight can significantly reduce your risk of GERD. Excess weight puts pressure on your abdomen, pushing up your stomach and causing acid to back up into your esophagus. Secondly, it's vital to identify and avoid trigger foods. These can vary from person to person, but common culprits include spicy foods, citrus fruits, and caffeinated beverages. Lastly, consider when you eat. Eating large meals or eating close to bedtime can exacerbate GERD symptoms. Instead, opt for smaller, more frequent meals, and finish eating at least 3 hours before you hit the hay. Remember, these changes don't have to be monumental. Start small, and you'll be amazed at the difference it can make in managing GERD. Speaking of food, let's delve into what you should eat and avoid if you have GERD. Diet plays a crucial role in managing GERD. When it comes to dealing with gastroesophageal reflux disease, or GERD, what you eat can make a world of difference. Certain foods can trigger uncomfortable symptoms, while others can help soothe the digestive system. Let's start with what you should eat. Foods that are generally easy on the stomach include lean proteins like chicken, turkey, and fish. You can pair these with whole grains, such as brown rice or oatmeal. Fruits and vegetables are also key, especially those high in fiber. Just remember to avoid citrus fruits, as they can trigger acid reflux. Now, onto what you should avoid. High-fat foods, unfortunately, are a big no-no. This includes fried foods, fatty cuts of meat, and full-fat dairy products. Acidic foods like tomatoes and citrus fruits can exacerbate symptoms, as can spicy foods. You'll also want to steer clear of chocolate, mint, and alcohol, which can relax the lower esophageal sphincter, leading to acid reflux. Caffeine and carbonated drinks are also common triggers, so it's best to limit your intake of coffee, soda, and even sparkling water. And remember, everyone is different. What triggers one person's GERD might not affect another's, so it's crucial to pay attention to your body and adjust your diet accordingly. Armed with this knowledge, you can make better dietary choices to manage GERD. GERD, while common, is a manageable condition. This journey we've embarked on together has hopefully shed light on the intricacies of gastroesophageal reflux disease. We've explored its definition, a chronic digestive disorder that occurs when stomach acid frequently flows back into the tube connecting your mouth and stomach, the esophagus. We've delved into the causes, from the weakening of the lower esophageal sphincter to lifestyle factors like diet and obesity. We've examined the diagnostic process, which can involve a variety of tests, such as endoscopy and pH monitoring. We've also discussed the treatment options, from lifestyle modifications to medications, and even surgery in severe cases. Prevention, we've discovered, can be as simple as maintaining a healthy weight, avoiding trigger foods, and not eating too close to bedtime. Speaking of food, we've highlighted some that are beneficial, and others to steer clear of when managing GERD. Thank you for joining us on this journey to better understand GERD. Remember, knowledge is the first step to better health.